You know, when you picture an emergency room at like 3:00 a.m., you usually picture just total physical chaos,
Huh.
like alarms blaring, doctors sprinting down the hall, IV lines being swapped out.
Right, it's just a blur of motion, all action, all the time.
Exactly. But amidst all those, beeping monitors tracking the patient's vitals, nobody is really tracking the vitals of the people actually saving them. We just sort of expect caregivers to be these unbreakable machines.
Yeah, right up until the machine breaks down. Which brings us to this invisible crisis unfolding in hospitals everywhere, a crisis where the caregivers themselves actually become the patients.
And that's exactly why we're doing this deep dive today. Welcome, everyone. We are digging into a practical guide called Jom Mind Feel Gym Now W by Dr. Fang Cheng Kar.
It's a really fascinating look at the reality of medical burnout.
It really is. Our mission today is to uncover how overwhelmed healthcare professionals are using this on-the-go mindfulness to survive severe burnout. And more importantly, how you can apply these exact same bite-sized mental tools to the chaos of your own daily life.
Right, because to understand the cure, we really have to first understand the sheer weight of the stress these caregivers carry. Dr. Fang identifies this phenomenon called Samua Socket syndrome.
Samua Saket, that translates to the everything hurts syndrome, right?
Exactly. Everything hurts. It happens when severe emotional stress literally forces the body to pay attention.
Mm-hmm.
We're talking about massive cortisol overloads in the nervous system.
Wow. So it physically manifests as what, like actual pain?
Yeah, severe bodily pain, chronic fatigue, serious gastric issues. It's the body saying, I can't do this anymore.
But, I mean, let me push back a bit here. Treating those physical symptoms without addressing the underlying stress, it's kind of like turning up your car radio just to ignore a rattling engine, right?
That is a perfect analogy. Eventually the engine just blows.
Right. But in a fast-paced environment like a hospital, isn't mindfulness just, I don't know, way too passive? You can't exactly sit cross-legged with scented candles when a patient is coding.
Oh, you definitely can. And that's what's so brilliant here. Mindful Lungem is designed as active, on-demand emotional first aid. It happens right in the hospital corridor. Take Chin Kai, for example. He's a male staff nurse who went through the 5-week program.
Okay, what was his experience like?
Well, by 2022, after dealing with excessive workloads, crazy long hours, and even workplace bullying, he was diagnosed with anxiety and depression.
Oh, man. That's heavy.
Yeah. And like most healthcare workers, he thought he just had to grit his teeth and, push through it. But he realized that's the classic empty vessel problem.
Right. You simply cannot pour from a cup that has nothing left in it.
Exactly. So he adopted this core philosophy. Self-care is we care. He realized asking for professional help wasn't weakness at all. It was courage. And to survive his shifts, he started using these micro tools, like the 5 mindful vitamins.
Wait, what exactly is a mindful vitamin? Like a literal pill?
No. Think of them as quick, structured mental reflections that you take like a daily supplement. So right in the middle of a chaotic shift, Chin would use one to just remind himself, this will also pass.
Huh. It sounds almost too simple.
It does, but actively applying that thought de-escalates immediate panic. It reminds the brain that the current crisis is actually temporary.
Okay, so that helps with the overall perspective. But how do you stop a mental spiral in real time? Like, let's say you make a tiny mistake and suddenly your brain is just crashing.
Dr. Fang refers to those mental traps as the ghost we think. And there's another great story here from Curly Lau, a female staff nurse.
Okay, what was her ghost?
She was so intensely focused on caring for others that she lived in this constant, anxious, problem-solving mode. She kept falling into what the program calls the 10 negative thinking errors.
Let's break that down for the listener. What is a negative thinking error? Is it like catastrophizing?
Precisely. Catastrophizing or black and white thinking. So one patient gets upset and suddenly your brain says, I am a terrible nurse, I'm failing at everything.
Oh, I think we've all been there in our own jobs. So how did she break out of that?
To combat this, Curly used a practice called knowing. N-O-W-I-N-G.
Knowing. Like being in the now.
Yes. It's the practice of observing your thoughts without automatically reacting to them as absolute truth. So instead of thinking, I am a failure, you observe, I am currently having the thought that I'm a failure.
Oh, wow. That creates a really crucial distance.
It really does. And to enforce this, she used a technique called mindful SISPO-P. It stands for stop, take a breath, observe, and proceed wisely.
I love that. It's like hitting Control-Alt-Delete on a freezing computer.
Yeah.
When you physically SOS-OP and take that breath, you're literally interrupting the amygdala, like your brain's panic center.
Exactly. You force your brain to reboot and route that energy back to your prefrontal cortex, the logic center.
But realistically, is a split-second breath going to fix systemic workplace burnout? I mean, it doesn't magically staff an empty hospital ward.
No, it definitely doesn't fix a broken healthcare system. But it prevents the individual from holding on to the cup of stress longer than necessary. It replaces a blind, panicked reaction with a wise action.
So how does the listener actually apply this? Because, most people aren't running down a hospital corridor.
Right. Well, imagine your boss sends a vague, passive-aggressive email at like 4:30 p.m. on a Friday.
Oh, instant panic.
Yeah.
Autopilot kicks in, my heart races, and my immediate instinct is to furiously type out a defensive reply or just sit there panicking about getting fired.
Right. But instead, you use mindful stoppy. You physically take your hands off the keyboard. You take one deep breath to interrupt that amygdala panic.
Okay, so stop, take a breath, then observe.
Yes. You observe your racing heart and those catastrophic thoughts. And only then do you proceed wisely, which might actually mean closing the laptop and just replying on Monday.
That makes so much sense. It just proves that mindfulness isn't some mystical escape from reality. It's a highly practical tool to anchor yourself so you can actually handle reality.
Absolutely. Self-care has to be a prerequisite for everything else we do.
Which raises an important question for you, the listener. As John Kabat-Zinn famously says, you can't stop the waves of life.
You really can't. But if you started applying these micro pauses to your own daily stressors, how quickly could you learn to surf?
Exactly. So next time you feel like you're standing in the middle of a chaotic 3:00 a.m. emergency room in your own life, remember to check your own vitals first.